Continuing part two of drugs required in acute clinical situations, we are talking about circulation and heart and cardiogenic shock. And we talked about, say, if the heart is beating too fast or too slow, then adenosine, amiodarone, we talked. And then if somebody is in fast atrial fibrillation, they may need beta blockers like bisoprolol or metoprolol. And then propranolol can be used in anxiety or thyroid storm. But then other causes of shock like hypovolemic shock due to lack of, so then you would give fluids, heart mints or normal saline. And then whole blood loss, then you could give whole blood, fresh frozen plasma or platelets, tranexamic acid for bleeding loss. Then if somebody is having, say, an obstructive shock or say something like DVT, and then for those you give anticoagulant for pulmonary embolism, and dalteparin, apixaban, heparin could be used. Then alteplase if somebody is in bad obstructive shock caused by PE. Then drugs like vitamin K and FFP for lack of clotting factors and if somebody is bleeding with raised INR. And then lastly, talking about the fourth kind of shock, distributive shock, then you use noradrenaline or metraminol. So these vasopressors help in maintaining the blood pressure. Then coming to D for disability, you're talking about say hypoglycemia, then 10% dextrose at 2 ml per kg given in children. For seizures, we know two doses of benzodiazepine, so lorazepam, diazepam, or midazolam could be given. Then levetiracetam is recommended, and then you could use thiopentone later on. Then acute behavioral disturbance, drugs like Loraz, ketamine, haloperidol, droperidol used. Raised ICP, so 3% saline and mannitol is used. Now coming to E for everything else. Then E for everything else. So we started with electrolytes. So hyponatremia, severe, treated with 3% saline. Then calcium gluconate required in hyperkalemia along with insulin, salbutamol. Then magnesium sulfate required for eclampsia and prolonged QTC. Then antibiotics, penicillin derived, and then cephalosporins, gentamicin, metronidazole, piperacillin, tazobactam, common ones. Antidotes, naloxone for opioids, N-acetylcysteine for paracetamol. Balance, soda bicarbonate used for metabolic acidosis. Lignocaine, bupivacaine, local anesthetics, and vaccine immunoglobulins like tetanus, hepatitis B, human rabies. What else and what so many other drugs can you think of if I missed any? Thank you.